Thank you, Godfrey. February is Heart Health Month. We've discussed pediatric heart health on Friday, and today we want to expand that conversation to include adult cardiac health with Dr. Alejandro Mesples, consultant at interventional cardiology with Doctors Hospital Health System. Good morning and welcome to Bahamas at Sunrise.
Hey, morning. How are you?
Thank you for being up with us dead early. I know you're a very busy person, so we thank you for giving us your time and your knowledge this morning.
Thank you. Thank you for the invitation. For me, it's very, very nice to talk with you.
Perfect. Thank you. So tell us, heart disease refers to what type of heart conditions?
Yes, heart disease, heart problems is the leading cause of mortality here in Bahamas. It's a big problem. We have a population with high incidence of high blood sugar, diabetes, high cholesterol. And it's very important for us first to know the situation and then to work with these patients, with people, because it's a very serious problem for us.
So tell us, in terms of the numbers of or incidences of heart disease in the Bahamas, how serious is it in the country?
It's very, very serious. We have information because we check hypertension and diabetes in patients with COVID. Many patients, and 80% of patients with COVID and ICU indication have hypertension. 80% is the number is very, very high. Wow. 50% have diabetes, and 40% have both risk factors. This is no good because these patients have many problems. And in the future, will suffer problems like myocardial infarction, stroke, and many others complications. The number is very high. If we compare the situation with other works, other papers published in Europe, we have 50% more incidence or prevalence of these risk factors here.
Wow, that's those numbers are very serious. And you always hear about these morbidities, especially when it comes to how a person responds to COVID. So do you find that heart patients have a more severe response to COVID-19?
Yes, we have information about that. And these patients with high blood pressure, with diabetes, have many complications. And in this special group of patients with COVID, we can see that half of these patients have heart failure or chest pain, myocardial infarction, myocarditis. And this situation, of course, is bad for the patient because the follow-up, the evolution is totally different than patients without these risk factors. Wow. We need to work with a lot with these patients because many patients have medication, have medical care for these problems, but have no controls. And is for cardiologists is a big challenge because we need to optimize the treatment of these patients and improve the general situation.
So talking about heart health, what are some of the factors that affect heart health and some of the dietary and lifestyle changes that can improve overall heart health in the country?
Yes, first, these two risk factors, high blood pressure is very, very important. Diabetes also is very important. High cholesterol is very important. Stress, no exercise, smoke is very, very bad because these patients have 2 or 3 times more incidence of cardiovascular problems, not only in the cardiac problems, cardiovascular problems, because the same disease that affect the coronary arteries affect the brain arteries, the leg arteries, and it's very important that the people prevent these complications. Prevent with diet, of course, with exercise, making sports, healthy life. The diet, is very important. And of course, every year, people need to check the evolution, and at Dr. Hospital, we can do that because we have the medical team, the equipment to check the cardiovascular situation very quickly, easy, and cheap.
Yeah. Yeah, and definitely the lifestyle changes, like you said, are important. Having a healthier diet, being a bit more active, and also, make sure you're managing stress and mental health. We know that it's been a stressful couple of years. Here in the Bahamas, we had Hurricane Dorian. Then we had COVID-19. We had the economy slow down. And so people have a lot on their mind, and there's a lot that's one would stress over. And it's important to realize a lot of these factors contribute to your overall heart health. So tell us, at Doctor's Hospital, what type of treatments are available for heart patients, persons presenting with any heart disease?
Yes, I agree totally with you. Stress is very bad for cardiovascular health. Many patients have chest pain, shortness of breath, palpitations. And at Dr. Hospital, we have the medical team, the equipment to check these problems, to make a right treatment with echocardiogram, with stress test. And eventually, if the patient needs an intervention, we can do coronary angioplasty and stent placement in the coronary arteries or leg arteries without problems. We have many patients treated with this technology. The technology at Dr. Hospital is high level, and the team work very well. We have more than 100 patients in these 2 years, in the last 2 years, with very, very good results. But it's very, very important not only to talk about treatment. I think we need to talk about prevention, because these patients with chest pain, shortness of breath, and many other things have hypertension, diabetes, high cholesterol. Of course, if the patient need to treat, we need to open the blockage arteries. We can do that very easy. And Dr. Hospital have the technology and the process, because it's very important. This patient need support, but not only cardiology support. These patients need rehabilitation support, nutrition support, general clinic support. It's a team. Now the medicine work like a team. It's very difficult to treat these patients. Patients and the doctor alone is a teamwork.
Yes. Yes, definitely a teamwork. And the Doctors Hospital Health System has an amazing team with great technology, ready to serve the public and help us get back on our feet. So Dr. Alejandro Mesples, a consultant of interventional cardiology with Doctors Hospital, I'd like to thank you for coming on Bahamas at Sunrise, talking about heart health in this Heart Health Month. Don't just worry about the love, worry about how your heart is pumping and your overall health. Watch your diet, lower your stress, and make sure you go and get yourself checked out. Thank you, Dr. Mesples, for joining us this morning on Bahamas at Sunrise.
Thank you very much again for this invitation. Thank you.
Thank you. You're watching Bahamas at Sunrise. We'll be right back.